So in this video clip, I will demonstrate how a cheek should be marked before injection. You definitely don't need to do so many markings before every injection, but this is an educational video, so we need to be exactly sure where we place the filler, because as you already know, layers are very important, especially in the cheek. So now we have a beautiful young lady who came to our clinic to volumize the cheek. She wants her nasolabial folds done and lips injected as well. So we will be starting from the cheeks. Now I am touching the bone, the zygomatic bone, and I want to evaluate where is the edge of that bone. And actually a natural fold that we can see corresponds with a bony edge. And the next landmark I want to note is the future location of the mid-cheek groove. I think you can see a full fat pad here. This is the nasolabial fat pad. It's a very subtle fullness here. Another volumized area, definitely small, is here. This is the malar mound or malar fat pad because it's not too big, or infraorbital fat pad. That's the same. So that's one of the superficial fat pads here, and another superficial fat pad here, the nasolabial fat pad. In the middle, we have a medial superficial fat pad, which is here, and I see that it's slightly depleted. It's very common for this area to become too flat, and this is one of our targets. This fat pad is full. This is also full. And the middle one, the superficial medial fat pad, lacks some volume. And in this area, if the fat pad would be completely gone or ptotic, we would have the so-called mid-cheek groove, separating those two. Now, this line, which marks the upper border of the zygomatic bone, is the future location of the tear-through. And this line is called palpebromalar crease. In every face, you can provoke, flex, and determine these landmarks, and they are very important. Now, what I also like to note is where is the lower border of the zygomatic bone, and it's here. Let's continue laterally. This is zygomatic bone. When I touch these areas, I sense the hard surface of the bone. Now, dangers. Here, we can easily palpate a hollow, right here. And I think you already suspect what it means. This is the location of the infraorbital foramen, where the infraorbital artery exits. If we would ask the patient to bite her teeth, we can sense the masseter muscle contraction, and we should mark that. Thank you. Along the anterior border of the masseter muscle, we have the course of the facial artery, which runs approximately here. We have the branch of a superior labial artery going here. There is also an angular artery on the side of the nose, but in this area it's not of the biggest relevance. And these are the blood vessels that we definitely need to avoid. Unfortunately, they run deep. So I've started by marking 3 superficial fat pads, and the middle one is our target. It's depleted. And as you know from another anatomical video clip, we also need to fill the deep cavities as well. And the deep cavity is so-called pre-zygomatic space. One ligament called orbicularis retaining ligament creates these folds, tear through palpebra malar, and that ligament is on the edge of the zygomatic bone. So that's the upper margin of prezygomatic space. The lower margin is zygomaticus ligament, which is at the lower border of the zygomaticus bone, right here. Now, superficial surface of that zone is the orbicularis oculi muscle, and the bottom is definitely the bone. So prezygomatic space is straight here. We need to make injections into 2 layers. Deep injection filling the prezygomatic space, and superficial injection into the superficial medial fat pad to enhance our injection a little more. Now, there is a very good course made by Dr. Mauricio de Mayo, the MD codes. Along the logic of MD codes, we should try to elevate facial structures as well. So I'll be injecting not only into the prezygomatic space, but taking MD code area cheek 1 to inject on the lateral part of the zygoma bone. These injections will create some contour. If we want to create even more contour, we need to enlarge dosage.